Well, it's still the Pinktober month, and of course, today marks the last day of Breast Cancer Month. Over this month, we've been talking about breast cancer awareness, care, nutrition, treatment, and the likes. So today, we're going to be reviewing everything we've done over this month on breast cancer. Welcome to Tea or Coffee. I am God's Time David.
You know, as a young lady, it will be unfair for my parents to lose me due to ignorance or negligence. The fight against breast cancer is a war against breast cancer, is a fight that we must win. And my name is Mudope Jacobs. Welcome to Tea or Coffee.
Hi.
Hi.
Good morning.
Hi, Pinky.
Hi. I'm still looking pinky. Today marks the last day of the breast cancer month. And I feel good in pink.
And I feel good in
blue.
In blue pink. I tried to do the pink thing.
Yeah, it's fine. How are you?
I'm fine.
Slept good?
Yes, you?
Yeah, I slept well.
So we're ready for the show today.
Yo, sure, we're ready.
So you were talking about the need to keep up the awareness, in as much as the month of October is ending today.
Today, yeah.
But that doesn't mean that the breast cancer awareness should stop.
Should
still let people know that early screening is important.
Apart from early screening being important, that there is a disease called breast cancer. Most people don't even know what breast cancer means. So the month of October, today is the last day in the month of October, and it doesn't necessarily mean that the awareness should die. So people should just know that there is a disease called breast cancer.
And also to change the notion, because most people feel that when it comes to breast cancer, it is particular to the female gender. It also cuts across all genders, even males, they experience breast cancer also. So we should be careful. We should stay away from things that trigger, breast cancer, and also have healthy meals. Because we discussed that in terms of nutrition.
And also, I think it's necessary for people to also know that it's really dangerous. So you need to stay away from alcohol and just know what to eat, what not to eat. Because I was going through something online yesterday. I was going through the surgeries. I saw some surgery. It was really bad. It was really disheartening. I was like, oh my God. So people still survive this. Most people lose their lives.
True.
So it's something that we should really be aware of and then see how to fight it. You said something in your opening that the fight of breast cancer is a fight we must win it. And together, we can't do this on our own. So together, I'm sure you're ready. Yes, I'm talking to you. I'm sure you're ready to win this fight because we're ready to keep the war going. Yes,
and also when we started the series, the breast cancer series, we talked about the need to show love to those that already, have diagnosed of breast cancer, because Wura Olakupola shared a story with us, and she talked about someone she knows that had breast cancer, but didn't die from the disease. She died from depression, from merely knowing that she had the disease. She got depressed and the likes. So such people need love. They need you to be around them, to encourage them, to support them, to let them know they are not alone and they can, win the fight against breast cancer. And also, we talked about that there are 4 stages of breast cancer, and it is better, when you find out, you go for checkup and find out in the first second stage. It's so manageable. But from the 3rd and 4th stage, it is very dangerous.
It's dangerous. And we also talked about the fact that when you feel a lump in your breast, don't freak out. Go for checkup. Most lumps are not cancerous. So don't just freak out. See an oncologist. See a doctor. Let them examine your body. And we also talked about the daily examination. Did you do yours today?
That's why I was smiling, because I know you have plans for me and it's not going to work. Okay, I did mine today. It's every day. The doctor encouraged, he encouraged that we check ourselves every day, not once in a month. Every day, because then you can quickly and easily tell when something changes in your breast.
Yeah.
Yes.
And love your body, love your breast. Know what to eat, know what not to eat.
And you brought the idea of touch yourself.
Touch yourself, love yourself. Don't just go looking all good every day. You spend your time, do your makeovers, get clothes and the likes. Just feel yourself, touch yourself, love yourself. And the only way you can do that, it's, of course, self-examination.
Yes.
And stay away from things that would not really help you. For instance, alcohol. I'm not here to judge anyone, but what do you stand to gain?
Yes.
So just stay away from alcohol if you can, of course, and just do what you have to do to stay alive.
And of course, if you have a family history of breast cancer, you should see your doctor in time, you know, just to go for checkups and ensure that you stay away from things that can trigger breast cancer. And also, God's time, David. I'm going to throw this to you now.
Bring it on, bring it on, bring it on.
How did you check yourself? Ding, ding.
No, Modupe, I was going to do that to you. Okay, thank you. But how did you check yourself?
No, I asked the question first, so you have to answer.
Modupe, no, we're not doing this on
we
air.
Started already,
we're not
so
doing
you can't opt out.
Okay, so I don't know what Modupe's plans are.
Okay, I will go. Okay, you're supposed to raise your hand up.
You're not raising it.
Really? Do you want me to go on?
Yes, please.
Okay, so you raise your hand up.
Okay.
And then you, 2 fingers.
2?
It can be 2, it can be 1. You check, like you press side. You go in a circular, circular motion. You don't really want me to do that right now, but let me just explain. You check it. And then you can, okay, so you lie down. And then you check also, you press the sides. Then if you see, if you experience any discharge from the nipples, you know that, yes, that is not normal. You have to complain. And then if you see any lump that is strong or either moving, as the case may be, you should also see your doctor. And if you inverted nipple, yes, you should also, if you notice any form of inverted, which is rare, yes. You should also see your doctor. So you should applaud me. I tried now.
Yes. Okay, so we're still here on the program, Tea or Coffee, talking about the review of breast cancer. Don't go away. When we come back, we'll be introducing our guest. Stay with us.
So you kind of tense the muscle and all. So if you're standing, you put one hand behind your head and use the other hand to check. So you divide your breast into 4 quadrants, like four divisions, and you go in the circular manner using just light. It don't have to be so deep, just very lightly. You do that 4, then you increase the intensity again. Go through the 4 corners, then don't forget to check the armpits. Then you press the nipple just to see for any discharge. You do the same for the other breast. But if you're lying down, which is the best actually, if you're lying down, you should put a pillow. If you're going to check the right breast, put a pillow at your right shoulder, lying down, and put your right hand at the back of your head. So the pillow is at your shoulder this way, and your hand is something like that. Then use your left hand to do the same thing. Divide your breast into 4. You should always divide your breast into 4 quadrants, and you go in circular manner, just a little bit. Then you go deeply a little bit also. You should also check the nipple and the armpit. Very simple. You do that for the other breast too.
That is so comprehensive.
Yes.
So as I was saying, those masses are benign masses. We call them benign because they're not cancerous. So the opposite of cancer is benign. So it's a tumor that is not cancerous. It's benign. So you have a mass in your breast that is not the structure of your breast. It's robbery. When you examine your breast, when you put it over your breast, you see that you form like a gallop. When you're touching like a gallop, you see it. It is very mobile. It's not fixated. It's mobile. You can move it around. That's when it's benign. But when you have a mass that is fixated, that you can't move it around, begin to think about, wow, there's something happens to that mass. It's it might not be benign, it might be cancerous. Because most cancerous masks, they are fixed masks. They are hard. They are very hard. They are fixed, and they're not mobile. Unlike benign masks that your friend had, which we see regularly. Okay. That's why we test them. So if at that point of taking another mask, you test it and it's cancerous, there's more prognosis of good health at that point, because you've tested it, so you can get help quickly than waiting for it to now be cancerous before checking it. What most people do in Africa is they wait until that small mass becomes very big, very hard, very fixated, and there's nothing you can do. You have to take out their whole breast.
Yes, we are back. Now we still have our guest in the studio here with us, Mr. Camille Salahu, a medical doctor. And yes, we're talking about the signs to look out for when it comes to early detection. So,
thank you. So, like I was saying, the first sign you would notice with breast cancer is a breast lump. So I'm sure previous speakers that have been on this show have emphasized on the characteristics of such lump. It's usually a hard lump that is not mobile, so it's fixed to one part of the breast. Most of the time, it's not painful, but occasionally you can have it painful as well. So after that, other signs you would notice is a nipple discharge, not a milky nipple, but a bloody nipple discharge. Changes around the skin, it could be some edema around the skin or some dimpling of the skin. And then sometimes, you sometimes don't even have that classic symptoms of breast lump and nipple discharge. You could just have a lump in the armpit that seems to have been there for several months. And that's why we keep emphasizing having self. Most often, I know women would be able to tell you that, look, doctor, I don't know what it is, but something just feels weird in my breast. And if you check, you probably would pick something up. So the idea is to, further evaluate and then differentiate if it's cancer or it's not cancer, because you can also have, benign things going on in the breast as well.
Okay. So just for the benefit of those who are just joining us today, most persons may have not had the time to join us in the past 3 weeks. So I would like to ask, what are the tests to carry out before the treatment?
Okay, very good question again. So the idea is to, first of all, go through the process of actually diagnosing cancer. So if I walk you through the process, is that a woman comes in, she complains of a breast lump. A doctor would examine to be sure that it's actually a breast lump. Depending on the age of the woman, then you decide what test that needs to be done. So you usually have some form of imaging done, either a breast ultrasound or mammogram. We usually advocate that women above the age of 40 years should have mammogram done. That's simply because over time, as women, your breast goes through changes as you age. So you find it such that mammogram is able to pick up changes in abnormal things in the breast for women who are older than 40 years than younger than 40 years. For women less than that who have more fibrous tissue in their breast, we use breast ultrasound. So from there, if the mammogram or the ultrasound, depending on the case, picks up any abnormality, the doctor would usually go ahead to get some tissue from the breast. So it's taking in a needle, take some samples, and then send to the lab, because that's usually the only way to confirm that something is actually cancer. So that's...
Okay, so let's debunk some misconceptions now about who is prone to having breast cancer and what actually causes, breast cancer.
Okay.
Now, one that I've heard is that using contraceptives, increase one's risk of having breast cancer. How true is that?
I would say it's true, but you see, these things they contribute to it. They're not necessarily. It's not saying. That's not to say that every woman who uses contraceptives will get cancer. There's a certain amount. It increases your risk of having breast cancer, but that's not That's not basically like a cause of breast cancer. So, and that's because if you go deeper into the biology of some types of breast cancer, they are hormone-dependent cancers. So, and you're using contraceptives, it's increasing your hormone levels, and that puts you at further risk of cancers as well.
All right.
Okay. So, talking about breast cancer survivors, now. I don't know. Before this time, when I hear breast cancer, I just freak out. Now, what's the chances, the survival chances of people diagnosed with breast cancer?
Okay, so I don't know if you noticed when you said that, the first thing I did was smile, because I say this with a lot of emphasis, is that breast cancer is not a death sentence. I mean, breast cancer is curable, and you can quote me, and I'm sure most of the speakers on this show have said the same.
Yes.
But again, early detection is key. If you catch cancer early enough, you can actually cure it. But, you know, depending on the stage, then you now begin to talk of different treatment options and, you know, your chances of surviving cancer. But yes, like you said, it depends on the stage. So for early stage disease, you're talking about a cure in 90% of patients. For more advanced disease, you're talking about, you're not necessarily talking about cure. A lot of times you're talking about remission or you can controlling the disease in 60 to 70% of cases. But patients who now have metastatic disease, what that means is that, you know, aside from having the cancer in the breast, it is spread to other organs. You know, at that point, you're no longer talking of cure, you're talking of, you know, managing the disease at that point in time. So it's dependent on the stage. But for early stage disease, the prognosis is very, very good. So that's why we keep saying, you know, early detection. Let women come out, let them get clinical breast exams, let them go for mammograms and every other test as well.
Okay, so one of the things that I've heard about what causes breast cancer is the use of bras.
Yeah, absolutely.
Yes, the use of bras.
Okay.
You know, when I actually heard that, sometimes at the point I had to be skeptical about actually using, you know, one of them because, you know, but what exactly is it about bras that, you know, adds or increases the risk of breast cancer?
Okay, so I heard this a lot, and, you know, the kind of profession we do, it has to be a lot, it's evidence-based. There's no evidence to suggest that your bra contributes anything towards your breast cancer risk. So you wear your bra, you don't wear your bra, to me, it doesn't make any difference. That's as much as I can say. But yes, you're right. A lot has been said on the internet that, you know, you wear tight-fitting bras. They should substantiate the claim. I mean, there should be some research or some evidence to prove that. But right now, there's nothing of such, so I don't think it. No.
Okay, well, that's pretty cool because I heard that as well. And most times they'll tell you don't sleep with bras. Take it off and the likes. Okay, so I want to talk about the side effects. Everything that has an advantage sure to have disadvantage.
Yes.
Now, what are the side effects
Of treatment.
of treatment, or maybe surgery? What are the side effects?
Okay, so first thing I must say is treatment, regardless of whether cancer or not, you know, every drug you take or every intervention you go for has its limitations and side effects. So the responsibility of the doctor is to weigh the benefits of you having any form of intervention, be it drug or surgery, as opposed to the side effects and complications of that. And most of the time, when the benefit of having such treatment outweighs the risk, then you'll be offered it. But if the risk is more, then, you know, your doctors will recommend other means. So for treatment of breast cancer, you can classify it into surgery, chemotherapy, hormonal therapy, and radiation therapy. Surgery, this day and age, with advances in anesthesia, that's the art of putting people to sleep during surgery. It's been advanced such that, you know, all the fears people used to have in the past, oh, if I go to sleep, I don't wake up, you know, things like that hardly ever happen these days. So, and the surgery is fairly safe. It's the breasts are so, they're external, so you're not having anybody going into your bowel, so it's a fairly safe surgery at this point. You hardly see complications from breast cancer surgeries, especially if it's done if it's done by experts who very good surgeons. So long-term complications would be some, because when you're doing breast cancer surgery, the first place breast cancer spreads to is the armpit. So sometimes the doctors go there and then take some lymph nodes. That's the tissues that the breast cancer spreads to. They take some lymph nodes. It's called a lymph node dissection. Okay. If you have that done sometimes, because the lymph nodes, they're responsible for draining excess fluids in our body. Sometimes some women have some arm swelling, but that can also be managed, like I said. I won't worry too much about that. These days, you don't do such extensive surgery like that anymore, so it's better managed, basically. For chemotherapy, the most common side effect, which everybody is always going on about, is hair loss. But with hair loss, once you're done with chemo, the hair tends to grow back, and from what I've seen with a lot of clients, it's even more pretty than the hair that was there before, because, you know, it's more coily. It looks very, very nice. So, something to look forward to if you're somebody on chemotherapy, that, you know, when your hair starts to grow back again, it's better than the one that was there before. There's nausea, there's vomiting, there's diarrhea. Those things can be managed, and they're usually short-lived. They're usually between about a few days to a week when you take treatment. Once you're through that phase, your body usually recovers over time. With radiation, common side effects would be local, because when we give radiation, it's focused to a certain area. So you could have some skin burns and some skin changes around it. But like I said, with advances in technology, better doctors and everything, you know, these things are being limited. So people hardly go through treatment without having side effects.
Okay. Sorry, very quickly. Now, you get the point where they have to maybe cut the breasts, cut it off.
Okay.
How do you manage patients? Because it's really disheartening to have to live with the fact that you used to have breasts and now you no longer have breasts and you're still alive.
Okay.
So how do you handle such patients? Because they could die of depression.
All right. So first thing I must say, because women are very sentimental about their breasts, so I'm not going to be insensitive here, and I'll try and explain. But the first thing is, not every woman that has a mastectomy has to have their breast removed. So there's something we call reconstruction now. So surgery is a dance whereby, we can preserve the skin of the breast. And then later on, at a later time, maybe when the woman is done with treatment, we can put in implants.
Wow.
Okay, that's possible. And if for any reason the actual skin of the breast has been taken out, you can have grafts. So you can have skin taken from the thigh or from other part or from the back, and then grafted and then put on the breast, and then you have implants. So there's a lot of advances in that.
That seems painful.
No, I mean,
is it still going to be functional?
Well, I mean, it serves one purpose. The aesthetics of having that breast there. You have that there, so you're able to wear your bra as you would normally wear your bra. It might feel different. I would agree that having an implant in one breast and then having a normal breast on the other side, it does feel different. But I mean, if you're talking about the psychological implication of having such extensive surgery done, it goes some way into relieving that fear that you might be deformed or so. For women who that is not an option and who eventually do have a mastectomy and have the scar there, I think every woman should be proud of their scar because it's a battle and you've won your battle, so it's a scar. So I mean, for me, I know it could be depressing for some women, but I think it's something some people should wear with pride. There are a lot of supportive instruments that you can use. So you can have artificial breasts. You've got special bras for women who have had mastectomy, whereby it's developed such that the breast where the side where the breast has been removed, there's been like an implant inserted into the bra that is about the same size as the breast on the other side. So you wear things like that, and then they're called mastectomy bras. You wear things like that, and people don't even know that you've had such surgeries done. So.
Yeah, okay. When we had the other guest, I think that was in the second week, and we were talking about the fact that when one breast is affected, there's every possibility it's definitely going to affect the second breast. Not in all cases, but sometimes it does. In a case where now, for a young lady, and then both breasts have to be cut off, and then she gets married, gets pregnant, how will she breastfeed that child?
Okay, so very, very good question. And I must say that first I'll start from the way you started the question is that, you've had breast cancer in one breast, the risk of having breast cancer in the other breast. I think that's the next step that, for Nigeria, it's been done abroad already. It's something that we're yet to get to in Nigeria, and that's genetic testing. Some people, will be able to identify that, in their family, they have a high risk of cancer. So you hear some people saying, oh, my mom had breast cancer, my sister had breast cancer, my auntie had breast cancer. Those kind of people, you should really, be curious and say, what's going on in this family? And if you go deeper and then you do some genetic testing for them, you'd realize that, there's a gene mutation there that put them at risk. So those are the women who, if they've had breast cancer in one side, there's a high chance that they could have breast cancer in the other side. But for normal women who you can't really find a genetic mutation responsible for their cancer, that they've had breast cancer in one side doesn't necessarily put the other breast at risk. But yes, you should ideally keep screening the other breast just to be sure that there is no cancer growing in the other breast. So back to your question of breastfeeding. At that point in time, you would have to use formulas. Abroad, they do things like getting surrogates to breastfeed. Yeah, so you get women who can breastfeed. So that that alternatives, formula feeds basically would be the way forward in Nigeria.
Okay, I've heard that when you get diagnosed and you're treated, there are possibilities that it might reoccur.
Okay.
Yeah, what are the chances?
So once you've had your primary treatment, and I say primary treatment meaning you were diagnosed with breast cancer and you've had all your treatment, that's your primary treatment. Your risk of recurrence is higher in the first 2 years. Okay? But as you go on and on and on, and so the idea is to keep, even after treatment, that's not the end of the story. I'm sorry to say. What you're expected to do is to come in frequently to see your doctors, They need to make sure you're fine. There are no signs that the cancer is coming back. And so the longer you go without the cancer coming back, so we get to that point whereby we start to label you as a survivor and someone who has actually, finished the battle of breast cancer. Initially, we used to use 5 years, but now there's a lot of advocates out there saying we should go as far as 10 years.
10 years.
So when a woman gets to 10 years from the primary treatment, at the end of primary treatment, and she hasn't had any recurrence, we can technically say that woman is 100% cured, and the chance of her having breast cancer is the same as somebody who has never had breast cancer before. So it's back to the risk of normal. So.
Angels from the realms of glory, wing your flight over all the earth.
Have a season of family adventure this holiday. High Impact Planet. Fun just got real.
Hello everyone. I'm delighted to welcome you and be your host on another exciting episode of Legends. Contribute in our own little quota, in any way we can, to the development of our society. I'm still your host, Victoria.
Exclusive to High Impact Television.
Have a thrilling and bonding experience at High Impact Planet Amusement Park and Resort. Enjoy an amazing retreat in our extremely secured environment with our breathtaking rides. Set goals for the upcoming year in our convenient multi-purpose halls. Bond between team members while giving your staff a desirable treat. High Impact Planet. Fun just got real.
You are still tuned in to Tea or Coffee, and we still have Camille Salau here in the studio with us, and we're talking about those that are prone to having breast cancer when it comes to the female gender.
Yes.
So please continue.
So I was talking about the risk factors for having breast cancer. So as I said, you can divide them into modifiable and non-modifiable risk factors. Okay. So the non-modifiable are things that it's out of your control. You really can't do anything about. And then the modifiable ones are the ones that, with adjustment of your lifestyle or, habits, you can actually change those things for the better. And so for the non-modifiable risk factor, the most obvious one is the female gender. Being a female puts you at a greater risk of breast cancer than a man. As a matter of fact, 99% of cases of breast cancer we see are seen in women, and only a very little percentage is seen in men. So it's what it is. No, you can't change your sex. So age is another risk factor for cancer. The older you are, the more your chance of getting cancer. That's why you see breast cancer in older women than younger. But yes, you can have cancer in younger women, but it's usually seen in older women. Right now, a lot of research is going into why we're seeing a lot of breast cancer in younger women now. You need to find out the things that, the changes that are going on. So other factors is familial history. So if you have a strong family history of cancer, there might be something in the genes in that family that is putting them at risk of cancer. And so for that reason, we need to test those people to be sure why they're having cancer. So, and then we go on to the modifiable risk factors, things you can do to limit your risk of having cancer. Number one for me is smoking. I know it's not really a big practice here in Nigeria, but abroad, you have quite a number of women who engage in smoking. It's something that puts you at significant risk of cancer, not only breast cancer, but other types of cancer as well. And it's a major contributing factor to cancer generally. Alcohol, I mean, the idea is just to live healthy, to be honest with you. I think alcohol contributes very minimal to breast cancer. However, to other types of cancer, it contributes a lot. So alcohol will be more important for, they're talking about things like liver cancer, but for breast cancer, its risk is very, very minimal. You know, things like their whole lifetime without ever getting that transformation from DCIS to cancer. While some women, you know, within a short period of time, they're already going into invasive cancer. So I don't want people to mistake DCIS for benign mass, but benign mass is, the risk of transformation to cancer is very minute, and I don't think it contributes anything. If it's a benign mass, it's a benign mass. And the reason why women would usually have it taken out is because it's causing some discomfort, or, you know, it's causing pain and things like that. But a lot of women have lumps in their breasts and they don't do anything about it. The idea is, you know, it's like, the thing is to know which is benign and which is not, which is cancerous. And once you know which is which, then you can treat appropriately. But benign masses, no, I won't worry too much about those.
Okay, so how long does the treatment take for normal breast cancer? How long?
Wow, that's a tricky question because, you see, medicine is going along that path whereby treatment is personalized. So we're not having a standard treatment for one person. We're tailoring treatment to suit the needs of the person in question. So surgery is done within hours. And then the recovery usually takes 2 to 3 weeks after surgery. Chemo would usually range about 6 months, depending on what regimen you are taking. Radiation between 4 to 6 weeks. And then hormonals, you could be on hormonals for 5 to 10 years. Wow. So, but I mean, that's just, hormonal, I know it sounds very, very complex, but hormonal is just basically a pill a day.
Wow.
Every day for 5 to 10 years. Yeah. So, it depends, like I said. It depends on the diagnosis, it depends on the stage, it depends on so many things to know what treatment which woman.
A pill a day for 10 years.
10 years.
It depends. That's if the woman has a hormone-positive tumor, whereby you know that this tumor is responding to hormones, so you can give anti-estrogens or anti-hormone treatments, and you know it's a pill a day, every day.
What if something happens and you forget to take it?
Oh no, so it's not a strict rule like that, whereby if you miss a tablet a day and then everything goes wrong. But the idea is to take it as regularly as possible. In fact, I insist that you take it every day, to be honest.
Okay, so now since we are doing a recap, we've dropped so much in treatment, care, and awareness. Let's talk about diet modification.
Okay.
Now, when it comes to trying to reduce, how do I say that now? Reduce risk of what are the foods to stay away from?
Okay, so I like that question, but I must say I'm not a nutritionist, so I'm sure a nutritionist will have a different opinion. But I think you can literally eat anything you want. The idea is to eat a balanced diet, to be honest. So, you know, get your 7 different classes, get your fruits, your vegetables, your fats, your carbohydrates, your protein. Basically, a balanced diet helps. Too much of anything is not good. We all know that. And I think really I've seen people who, you know, live this kind of very healthy lifestyles and still end up with breast cancer. I see people who do the opposite and then don't have breast cancer. So it's, you know, diet there's very little you can, but eating healthy, balanced diet helps, basically. Keeps it.
You know, the nutritionist we had talked about the fact that we should take more of cabbage, cucumber.
Okay. I think she mentioned sugar cane.
Yeah, stay away from sugar. Stay away from sugar.
And then
take sugar cane, dates.
Okay.
So you can take dates. You know dates, right?
Yes, I do.
Yes, dates.
I do.
Then what else did she say? Honey. Real honey, not the adulterated one.
So for me, I mean, I would agree with that from the angle that, you know, it's good to eat healthy. And, you know, we advocate for that every day. But I think that would be more important for dealing with diabetes. So if you're diabetic, then you need to adjust your diet appropriately. Yes. If you're hypertensive, you need to stay away from salt. But, you know, when we're dealing with cancer, I would just say a balanced diet. Have a bit of everything, not too much of anything. And you'll be doing the right thing that way.
All right.
So, okay, so very quickly, we'd like for you to see a video of breast cancer in summary. Don't go away.
The month of October is known to be the Breast Cancer Awareness Month. It is an annual international health campaign organized by major breast cancer charities to create awareness and raise funds for research into its cause, prevention, diagnosis, treatment, and care. The campaign also offers information and support to those affected by breast cancer. This yearly campaign intends to educate people about the importance of early screening, tests, and more. Male breast cancer, which is rare, is generally overlooked. In 2009, the Male Breast Cancer Advocacy Group Out of the Shadow of Pink, A Man's Pink, and the Brandon Green Foundation for Breast Cancer in Men joined together to globally establish the third week of October as Male Breast Cancer Awareness Week. Doctors estimate that about 5 to 10% of breast cancers are linked to gene mutations passed through generations of a family. If you have a strong family history of breast cancer or other cancers, your doctor may recommend a blood test to help identify specific mutations in breast cancer or other genes that are being passed through your family. Factors that are associated with an increased risk of breast cancer include being female, increasing age, a personal history of breast conditions, a family history of breast cancer, inherited genes that increase cancer risk, obesity, drinking alcohol, having never been pregnant, having your first child after age 30, amongst others. Breast cancer risk reduction for women includes breast self-examination, maintain a healthy weight, choose a healthy diet. However, breast cancer is not a death sentence, as the treatment includes surgery, chemotherapy, radiotherapy, amongst others. Join the war against breast cancer. The war against breast cancer is a fight we must win. Tea or coffee continues.
Yes, that is beautifully packaged, breast cancer awareness.
Yeah.
Yes, for you. So since like we said, in as much as the month of October has come to a close, to an end, the awareness for breast cancer awareness should not stop.
Yeah,
should not stop. Yes, so Mr. Camille Salau. Yes, we know breast cancer is not just particular to the female gender.
Okay.
It also cuts across the male gender.
Okay.
So when it comes to the male gender, what triggers breast cancer?
Pretty much the same thing that triggers breast cancer in a woman. The men have breasts as well.
Mm-hmm.
So the risk that applies to females is the same risk that applies to the men as well. But besides that, pretty much.
Okay.
It's an area not too well researched yet, but there's still a lot of research going on in all this area.
Okay, thank you so much.
Thank you so much for taking our time out of your busy schedule to come for the program.
Thank you.
And I'm sure you've learned a whole lot.
Yes, I've learned a lot. It's amazing since we started the series that's breast cancer awareness. I've learned a lot that I need to check myself every day. We first had a guest that said once a month. Yeah, but then our second guest came and said no, every day. And I think that it's better every day, because then you get to know on time when something goes wrong. So I've learned a lot, basically.
Yeah, I've also learned that not all breast cancers are cancerous. So when you hear breast cancer, it's not a death sentence.
Not all lumps.
Or not all lumps. Not all lumps are cancerous. So the minute you hear breast cancer, it's not a death sentence.
Yes.
So just be aware that there is a disease called breast cancer. Self-examination cannot be overemphasized. You see your oncologist, see your doctor. Don't take your health for granted. It's been an awesome month talking about breast cancer, having to go in pink every Wednesday on the show. It's been wonderful, and I'd like to thank you so very much for staying tuned to the program. Till tomorrow, my name is God's Time David. Do take care of yourself and each other.
Yes, the fight and war against breast cancer is a fight that we must win, and together we must create awareness. My name is Mudukwe Jacobs, and thank you for watching Tea or Coffee today.
So we're just going to do this. The fight, let's have your hand.
Yeah.
The fight against breast cancer
is a fight
that we must win. Okay, bye-bye.